The best pre-diabetes symptoms and how to treat them to prevent diabetes. Did you know that your body may be sending you warning signs that your blood sugar is higher than normal, but you may not be aware of it? Pre-diabetes occurs when your blood glucose levels are greater than usual but not high enough to be diagnosed as diabetes. So, what's the big deal about pre-diabetes? The reason is that 75% of people with prediabetes progress to full-blown type 2 diabetes, despite the fact that prediabetes is completely reversible. According to statistics, more than 88 million adults in the United States have prediabetes, and 90% of them are unaware of their condition. That's more than 1 in every 3 adults, or they dismiss the symptoms as minor health issues, sometimes for months or even years. Diabetes, on the other hand, is far from minor, and early detection and treatment can mean the difference between living a long and healthy life and suffering from health issues such as nerve damage, kidney disease, heart disease, stroke, and blindness. Welcome to the Health Hub, where information meets motivation and wellness, creating more connected health tips to help people on their path to better health. In this video, we are going to talk about the best pre-diabetes symptoms and how to treat them to prevent diabetes. Make sure to stay tuned until the very end because some of these symptoms will really catch you off guard. We'll also outline the actions anyone can take to cure pre-diabetes. So let's get started straight away. This video is instructive as always and does not constitute medical advice. We are not medical professionals. Weight gain and hunger. Consistently, high blood sugar makes it difficult to do the one thing that can really help pre-diabetes: lose weight. Insulin-resistant cells find it difficult to take the glucose from the blood, so sugar levels rise. Insulin resistance also makes you hungrier, causing you to overeat. Extra blood glucose tells your pancreas to produce more insulin, but more insulin encourages your body to store the excess sugar as fat. As a result, the cycle continues. Other research indicates that pre-diabetic people who prefer evening activities go to bed late and do not get enough sleep and gain more weight. Simply losing 5 to 10% of total body weight can significantly lower blood sugar levels. Wounds heal gradually. Patients with prediabetes may experience sluggish wound healing. Over time, elevated blood sugar can cause damage to the inner lining of small blood vessels, resulting in impaired circulation. Thus, small cuts and bruises may take longer than usual to heal. Tiredness for no apparent reason. Pre-diabetics have already insulin resistance. That also means their bodies are unable to convert the glucose in their blood into energy efficiently. As a result, there is unexplained fatigue. Even if they are not physically exerting themselves, people with pre-diabetes may feel exhausted. Glucose levels in the blood are higher than normal. Pre-diabetes is defined by blood glucose levels that are higher than normal. This indicates that the fasting blood glucose level is between 100 and 125 milligrams per deciliter, and the hemoglobin A1C level is around 5.7 and 6.4%. Pre-diabetes is also known as impaired glucose tolerance or IGT, or impaired fasting glucose or IFG. Skin disorders. Some individuals with insulin resistance and pre-diabetes may develop acanthosis nigricans, a velvety darkening of the skin on the back of the neck, armpit, groin, or elsewhere. Eyelid, neck, armpit, and groin skin tags are another indication of elevated blood sugar. Unexplainable changes in mood. Optimal glucose levels are necessary for mental health. When blood sugar levels within the brain are above average, a person becomes more agitated, irritated, furious, and unable to concentrate. When stress levels rise, insulin becomes less effective, and blood sugar levels rise. Yet, when blood sugar levels return to normal, these symptoms frequently disappear. Digestion problems. Researchers discover that people with prediabetes have a higher frequency of gas, bloating, early satiety, nausea, heartburn, and constipation. This could be due to vagus nerve damage caused by high blood sugar, which causes chemical changes in nerves over time. The vagus nerves controls how quickly your stomach empties, and when it is damaged, food remains in the stomach for longer than it should. This is a condition called gastroparesis. If digestion problems persist or cannot be explained by eating habits and other conditions, it is best to have a pre-diabetic assessment performed by a doctor. Vision problems. Diabetes can increase the likelihood of visual loss, or retinopathy. High blood sugar causes the lens of the eye to expand, which inhibits the ability to focus. However, the blurring disappears after blood sugar levels return to normal levels. This symptom is frequently associated with prediabetes following a diagnosis. Excessive thirst and frequent urination. When you have an excess glucose in your body, your kidneys are unable to reabsorb all of the blood sugar and return it to your blood vessels. As a result, sugar exits your body through urine, causing you to use the restroom more frequently. As a result, your body craves more water, leaving you thirsty all the time. It's a never-ending cycle. Caffeine consumption may cause coffee and tea drinkers to urinate more frequently. Frequent urination may indicate prediabetes if this stimulus is not present. Kidney failure. Prediabetics frequently have undiagnosed chronic kidney disease or CKD. More than 1/3 of people with prediabetes were found to have signs of kidney disease in one large study. Furthermore, the stage of kidney disease is 3 or 4, the same as in diabetics. Stage 5 is the most severe. This is when a person requires dialysis or a kidney transplant. Joint aches. Pre-diabetics have excess body weight, which puts extra strain on the joints, particularly the lower body, and increases the risk of osteoarthritis. According to a recent CDC report, 32% of adults with pre-diabetes also have arthritis. Approximately half of adults with both pre-diabetes and arthritis are either physically inactive or obese, further increasing their risk for type 2 diabetes. Researchers discovered feet and hands are numb and tingly. According to research, pre-diabetes can damage nerve fibers and cause nerve deterioration without causing type 2 diabetes. There appears to be a bidirectional relationship between impaired glucose tolerance or IGT and neuropathy. A significant proportion of people with idiopathic neuropathy have prediabetes, and a significant proportion of people with prediabetes have peripheral neuropathy. Do you have any of the following symptoms? What steps can be taken next to reverse prediabetes? The treatment for prediabetes and type 2 diabetes is the same. Here are the steps to losing weight and lowering blood sugar levels. Get regular exercise. A 30-minute brisk walk every day works wonders. Get enough quality sleep. Maintain proper sleep hygiene. Reduce the amount of added sugar and sugar substitutes you consume. Eat whole, unprocessed food for a good list. Consume enough fiber, omega-3 fatty acids including ALA, berberine, magnesium, zinc, chromium, and vitamin D3. Manage stress by maintaining a healthy balance of hormones including insulin. Track your progress. Who is at risk for developing prediabetes? If you are over 45 years old, have excess abdominal fat, maintain a sedentary lifestyle, or have a family history of diabetes, you should consider getting tested for prediabetes. Hopefully this video has answered a couple of questions. Thanks for watching. If you enjoyed, please give us a like, subscribe, and comment for more health tips.